Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolf, and tonight we're joined by Christopher Sandals, who is the Medical Director and CEO of the South Texas Veterans Healthcare System, and this is our COVID-19 update for the San Antonio community. Tonight we're reporting 179 new cases of COVID-19, which brings our total to 203,370. Our 7-day rolling average now is 185. Sadly, we do have one new death to report tonight, and please, again, as we've said before, please keep their families in your prayers as each of these numbers that we report each night is a loved one who is dearly missed. There are 184 COVID-19 patients in local hospitals this evening. That's down 4 from yesterday. Over the last 24 hours, there were 37 new admissions for COVID-19. 75 patients are in the ICU, and 40 are on ventilators. A vaccine update now. As of yesterday, Bexar County has administered the vaccine first dose to 445,651 people, and 249,552 people are fully vaccinated in our communities. That's good news. I'm also pleased to report that nearly 60% of people aged 65 and up have received at least one dose of the COVID-19 vaccine. And a special note, effective Monday, anyone 80 years or older can show up at the Alamo Dome or one of our public health sites at any time without an appointment and get vaccinated. And in the meantime, let's all continue to do our part, wear our masks, social distance, and proper hygiene as we work in our community to get more people vaccinated. And remember that you can also sign up for text alerts to know when there's appointments available by texting vaccine or vacuna to 55000. Let me turn now to Judge Wolf.
Yeah, thanks, Mayor. And vaccine, we're racing as fast as we can to make sure everybody gets a vaccination. Out at University Hospital, Bexar County Hospitals District, we've done 243,000 now since we started at the site at Wonderland, as well as the downtown Robert B. Greene Hospital. This week we're running about 6,400 a day. For the first 4 days, we've done 22,967. And we started taking sign-ups for those that are 80 plus, giving them priority. We've had 300 sign up already, and they have the priority. They can come and get their vaccinations right now. So we're moving along fine there, and we just need to try to get the vaccinations working as much as we can. And the good news is that the federal government's providing some vaccinations to a lot of other providers, whether they're pharmacies or grocery stores, and that's helping us get shots in everybody's arms. So we're moving along, and I think we're on a good pace to try to get everybody vaccinated. I might just say very briefly, as you know, we'll be having these young people that will be providing a safe haven for them at the Bexar County grounds, and we have some strict protocols of how we will handle cases there. All the children, before they leave the border and come here, we'll have a test to determine whether they're positive or not. While they're here on site every 5 days, they will be tested again. And those that are positive, they'll have a separate cohort for them where they have medical people there and be separated from the rest of the population. All the adults that will be working there, we may have up to 300 staff out there working. They will be tested, and everybody within the facility that will be there, the young people, they all have to wear a face mask. So extra precautions are taken to make sure we handle them. They're not going to be out in the community. They'll be in the center till we find a place to take them, whether they're with the family, whether it's a mother, father, grandmother, grandfather, uncle, aunt, and try to get them placed with the family. Or if we can't place them with the family, then they'll go to one of the licensed care facilities, such as St. Joseph's here in town, or some of the other places that we have here that can take them and decide how they would be handled in the long run. So we're being extra cautious on COVID.
Great. Thank you, Judge. Before we wrap up tonight, I'd like to turn it over now to Chris Sandals, who is going to give us an update on the care of our veterans in our community with regard to COVID-19 and the vaccination process. Chris.
Thank you, Mayor. It's great to be with you again. You know, it really has been a somber day and one to celebrate at the South Texas Veterans Healthcare System. Somber because this was the 1-year anniversary for us today of we provided the care for our first hospitalized COVID patient. So we had a very warm reflection activity today for our staff, very well received. But very hopeful as we continue to move aggressively with vaccine rollout. Obviously, our volumes aren't near as high as the county, but I'm proud to say we have moved through about 45,000 doses across our healthcare system of just over 100,000 patients. So I'm feeling really good there. As a result of that, effective Monday, all enrolled veterans in the South Texas Veterans Healthcare System will be eligible to receive their vaccine. You'll be receiving some text messages from us through a system we use called VetText. That'll be notifying you that you're eligible for a vaccine, and we'll walk you through the process to schedule that vaccination with us. So please be looking out for that text message and respond to it to schedule it accordingly. Also, some may have heard about a new law that was signed this week by the president called the Save Lives Act. This law is going to expand VA's eligibility to provide vaccination to a broader population of veterans. Not all veterans are eligible for VA health care, but this is going to allow us to provide vaccinations to all veterans regardless of discharge status or service connection. It's also going to expand eligibility to veteran spouses and caregivers and a few other categories. We're still working through some of the implementation, but again, I think it's going to be an opportunity for us to vaccinate as many veterans and additional American citizens as we can. If you'd like to learn more about that Save Lives Act, you can go to southtexas.va.gov. You'll see a link there for vaccine information, and if you click that, you can register for regular updates so that you'll know when you could receive your vaccination from the South Texas Veterans Healthcare System. And we definitely look forward to doing that. So that's all I've got for you today, Mayor.
Great. Thank you very much, Christopher. And we also want to remind you, if you're struggling through this pandemic, paying rent or mortgage, there is assistance available for you. Call 311 to access our emergency housing assistance program. Also, if you're out of work and without income and would like to sign up for our training program, which is training for jobs available today in our community, you can do so by calling 311 or enroll for the Train for Jobs program by calling 210-224-HELP. You'll be enrolled in the training program and receive a stipend to make ends meet while you do. Finally, want a quick note on the schedule of our COVID briefings. We are going to be moving to Mondays and Thursdays as these trends move in the right direction. We'll also be providing you a detailed update as the vaccination process continues to roll out. So we will be moving our briefings to Monday and Thursday evenings. Again, as always, you can get the latest on COVID-19 by texting COSA.gov to 55000 or by going to the website covid19.sanantonio.gov. We're continuing to move in the right direction. Please continue to do your part protecting yourself and your family. Mask up, practice social distancing and proper hygiene. Do it for yourself, do it for your family, and do it for San Antonio. Christopher, myself, and the judge are available for questions.
For Mayor Nirenberg and Judge Wolf, could you give us your reaction to a court ruling that Austin and Travis County can keep enforcing their mask mandates?
Well, this just came in just about an hour or so ago. It's certainly going to be appealed. I think that's what the Attorney General has already indicated. But our message continues to remain the same, and we're glad that that there seems to be a clear majority of folks out in our community who are continuing to do their part, and masking up is something that they can do to protect themselves and others as we continue the vaccination process roll out.
You know, when we didn't have the mandate, as according to the governor's order, we couldn't do it. And of course, as the mayor said, that will be appealed. But the thing I think we've learned is that as you go around the community, people are doing it. I mean, they're wearing their face mask, and I was worried that they wouldn't do that. But I think we're getting really good. Citizens of San Antonio are really responding in a positive way. I guess we'll wait and see what happens with that lawsuit. But you know, generally you win at the district court level, and then you get to a Court of Appeals, and you end up getting shot down. So we'll see.
And regardless of all that chaos that's been happening over the year, thank you for the folks that are doing the right thing by mask wearing, and we hope that they will continue to do that.
We are hearing from the hospitality industry that there's a staffing crisis. What do you say to those folks who are unemployed and do not want to get back to work, whether it's because of fear or because they're earning more money through unemployment? And the staffing issues could impact the city's and county's economy. some restaurants have already had to shut down because they don't have staff. How do you address that as a city and county?
You know, what I would say is, again, the impacts of this pandemic from a health standpoint, but also in the economy, have been merciless, and it hasn't spared any industry, and that includes especially hospitality, restaurants, bars. And so how we've responded is to make sure that we have resources available. So we've allocated roughly $50 million in small business grants to our small business community, as well as about $26 million specifically for hospitality and food and beverage. We're going to continue to aid our small business community the best we can, providing resources and in some cases backup as they continue to work through operational changes during this pandemic.
You know, I've heard that was a problem. I don't think it's because people are scared anymore. I think it's a lot of people are getting a lot of extra benefits today. I know checking account balances have gone way up, and that may be part of the issue that they're having, is that with the checks that they're getting from the federal government and everything, that maybe some people have chose not to do that. I really don't know what to do about that. I mean, that's an individual choice, and I know that a couple of restaurants I've been in, I think it depends on, you know, the level that a person can earn. You know, in a more of an upscale restaurant, they're going to go to work because they're going to earn a heck of a lot more. And one that's where they get a minimum tips, maybe they've decided not to work at this time.
It's an impromptu interject, guys, but what I'd say, two ends of that, you've got the employee and the employer. Obviously, the Department of Veterans Affairs is always looking for an opportunity to assist veterans with employment. So we often say the best bet is to hire a vet. So if there are employers out there that are looking for staff, they can always reach out to their VBA, Veterans Benefits Office. They typically have a myriad of veterans that are going through rehabilitative programs that are looking for placements, as do we at the South Texas Veterans Healthcare System. So we'd encourage them to reach out to us if they're looking for staff. I'm sure we could try to find a way to support that as well, and to assist the veteran in their transition.
Are public health officials here discussing the possibility of a mask mandate?
We have been focused on ensuring that the Public Health Authority is making the clear case for mask wearing regardless of what the mandates at the state level are. We obviously are watching that court case, but you know, as the judge has stated, we're observing great compliance with that guidance. The other thing is we're asking businesses to continue to encourage mask wearing, and we will support them by criminal trespass if necessary if folks are not complying with their own business rules that they've established in their facilities.
I think the only mask mandate you could be is possibly with the employer, but everywhere I've been, they've either demanded it or they've strongly encouraged it. And when I've gone into businesses, they've all had masks on. So I think our business community is saving us by, really pushing that.
It was revealed today that a request by a local official to set up a FEMA vaccination site at the Alamo Dome was denied. Could you give us your response?
Yeah, well, you've heard us repeatedly on this briefing in letters and even our bipartisan delegation asking for a mass vaccination site to be set up in the city of San Antonio. We have one of the highest case mortality rates and highest social vulnerability indexes in Texas. We have all the reasons you would want to set up a site here in Texas, but in San Antonio, but to this point, that has not been done. It's very disappointing. We need, and I would ask the Fed to step up and provide more vaccines through a site or through simply just providing more doses to the San Antonio area.
Yeah, I think that if we had got more vaccines and got them directly from the federal government, we could open another mass vaccination site fairly quickly. But you have to have the shots to be able to do that, whether it's Pfizer or Moderna.
People getting vaccinated in Bexar County and San Antonio today?
Could Could you repeat that again?
Yeah, what is the average number of people in San Antonio getting vaccinated per day?
Average number of people. Per day vaccinations. I mean, with our public health sites, I think if you include the Dome, UHS, and WellMed, we'd have to get a more accurate number, but I think it's probably in the 6,000 range.
I think it's even more than that, because y'all are doing 2,000 or 3,000, and we're around 6 or so. And then I don't know what WellMed's doing, and all these other providers. I just have no idea how many shots they're giving.
Yeah, let's get that number for you on Monday. We can get you an accurate number per day from just the public sites. Again, there's other sites that are active that are getting their vaccines distributed directly, but they're private labs and doctors' offices and clinics.
Our data is not public. We're doing about 1,000 today.
Mayor, will there be a special city council meeting to discuss a vaccine registry again?
Yes, and I welcome the conversation again, as the eligibility criteria has essentially dropped away as of Monday. We're going to discuss it again. As you know, we've discussed it in the city council session a couple of weeks ago. We directed the city council community health and equity committee to take a look at it. I don't know what came about that conversation, but they've asked for another conversation at the city council meeting, which we will do. And again, I welcome that conversation, because there is a severe imbalance between the demand for the vaccine and the supply that we have in this community, and we're working through it the best we can.
Even though we don't have a wait list, the last numbers I saw, maybe it's about a week ago, we're vaccinating more per percent per population than the other major metropolitan areas. So I guess we'll see what you guys come up with.
Yeah, and there's no doubt shots are getting in arms in San Antonio. There's no doubt about that. Wish there was better ways of easing the frustration along the way.
That's all we have tonight. Thank you.